So I'm here with Diane, and Diane is 61 years old. She's 6 weeks out from a facelift, a brow lift where we made an incision right at her hairline to lift up her brows. We did a lower blepharoplasty, excuse me, and then we did some lip augmentation. Diane is a school teacher. She's actually a principal at an elementary school, and we felt like Diane earned a facelift because she had mostly good kids, but there's a few kids that gave you a run for your money, right? Over the years.
My own.
And so Diane definitely felt like, and I believe that's the case, that children sometimes take enough out of you that you earn a facelift. And so she's 6 weeks and back to school and back with parents and teachers and everything else. And Diane, I just wanted to give you a chance to kind of talk about your experience and tell me how you're doing and feeling. And
it was a great experience. The surgery went off without a hitch, as far as I know. Nobody's telling me differently. I followed all of the, take this pill whenever. I followed that like a religion. Sore maybe for a couple days, but really not bad, mostly just tired, and that's from the anesthesia, right? Mm-hmm. And then my face was really tender, like for a couple weeks, like to wash my face even was I was just very tender. I was very gentle. I kept the salve stuff up here, and I cleaned like I was supposed to, and within 2 weeks I was able to, actually I went back to work after like a week and a half. I probably should have waited 2 weeks, because by 2 weeks I could cover it all with makeup, mm-hmm. and nobody would have known any better. Mm-hmm. I am especially happy with my eyebrows because they got lifted very nicely, and I have to say that I do love my lips. So overall it was all a very good experience, and when I'm looking at the before and the after, I don't know who that old ragged lady is, but I think that my husband should be a pretty happy man mm-hmm. now, because mm-hmm. the difference is incredible.
Well, I'm so excited for you and so happy for everything. You've mentioned a couple things that I think are really helpful. Number one is we give you the instructions for a reason. We've done mm-hmm. this hundreds and hundreds and hundreds of times, and so having a routine that we follow is very important to give you the best overall outcome, mm-hmm. quickest recovery, and there's a reason for it. So thank you for following that, and definitely recommending that we follow that. The other thing is kind of anticipated recovery time. And most people, they are somewhere between 1 and 2 weeks that mm-hmm. they feel comfortable going back, probably with a little bit of makeup on to cover yes. up the last of the bruising. But generally it's during that second week that you feel ready to get back to the mm-hmm. majority of your normal activities. And so usually what we say is during the second week, have everything cancelable. So you can do things, but it's not like the end of the world if you were to say, okay, I'm not quite ready, and you can kind of just cancel things. I think that's usually the counsel that I give to people for recovery. So. Mm-hmm. Thank you for letting us share your story with all our followers.
Well, thank you for your good work. I appreciate it.
And I'll make some comments about her pictures on a future post or the next video. So I want to just point out a couple things on Diane's face as we closely evaluate some of the results of her procedure. So for Diane, kind of starting at the top of her face, we did a brow lift. Now this is just a brow lift alone. We felt like that was the main thing contributing to the heaviness on the upper part of her face. You can sometimes do a blepharoplasty where we take off this thin rim of skin and a brow lift together, but the majority of people, I feel like they benefit from one or the other. The type of brow lift that we did was what's called a trichophytic brow lift. And with that brow lift, you make an incision right at the hairline. At 6 weeks, you can see just this little tiny kind of faint pink line. It's going to fade over time. It's going to disappear 100%. But this type of brow lift is very powerful in lifting up just extremely heavy brows like you can see here. The other benefit of this approach to a brow lift is that in somebody with a very tall forehead, so if you look at the height of her forehead, you can see that had we done an endoscopic brow lift or a coronal brow lift where we're making incisions behind the hairline, that in essence lifts the hairline even further. If she starts out with a tall forehead and you do an endoscopic brow lift, then you end up with a higher forehead and they're just not happy with that result. And so we decided to do a trichophytic brow lift where we make an incision right at the hairline, you lift all of the connective tissue off the brows, and then you pick the brows up. And like I said, this is a very powerful way to really elevate and hold those brows in a natural position forever. So nothing else to the upper part of her face other than just a brow lift. Underneath her eyes, we did a lower blepharoplasty, and I do a transconjunctival lower blepharoplasty where you go through the inside of the eyelid. You can see this puffiness. So these are little fat pads that live underneath her eyes. There's 3 of them. There's a medial fat pad, or nasal fat pad, a medial fat pad, and a lateral fat pad. So we went through the inside of her eyelid. We took those little fatty pads out, and then in her situation, we actually took that fat and we replaced it in the sulcus down underneath her eyes. So we took away the puffiness by removing the fat and then added it to the sulcus underneath. So you take down the mountain, fill in the valley at the same time. So that's kind of that portion of her face. Now, down here in her cheeks, this is a deep plane face and neck lift. And in essence, what you're doing is, I'm going to show you the 3/4 view here. In essence, what you're doing with the deep plane facelift is you make incisions kind of around the ears here, back here behind the hairline. This is 6 weeks. And so again, she's got a little bit of puckering here, a little bit of pinkness that you can still see. It's going to fade over time. The hair's going to grow through the scar. It disappears completely. But you elevate just a little bit in the subcutaneous plane right out here. And then you transition down beneath the smaz layer into the deep plane. And you elevate in the deep plane all the way across some ligaments that hold her cheek in position. So these are called zygomatico-cutaneous ligaments. We divide those ligaments. You elevate all the way almost to the corner of the mouth. So I'll elevate in the deep plane down to about right here. And then in the neck, you elevate in the deep plane underneath the platysma muscle all the way down here. And then you pull backwards on this portion of the smaz and vertically on this portion of the smaz. It lifts the midface, tightens the jowl, really tightens up in the neck, and you can see just a big change for her there. Now, I want to point something out. The main difference between a deep plane facelift and a smaz lift or a purse string facelift is the permanence of what you get in the midface. So if you're looking at somebody and you say, did I have a smaz lift or did I have a deep plane facelift? If you look at this part of the face and you can see effacement of that fold, so you can see lifting of the cheek, this is what you get with the deep plane facelift. This is the main benefit. This is not a mid facelift. In fact, I don't really do mid facelifts anymore because we get such incredible lift in the mid face with a deep plane facelift that I don't feel like it's necessary anymore. We don't do fat grafting into this area very often. I do every now and again, but it's pretty uncommon because of the amount of lift that you get in the mid face. So this is where you win with a deep plane facelift. It elevates the mid face better than any other technique, and it doesn't do it for a temporary period of time. It's really a permanent change where it's going to last for years and years and years. A decade plus is how long it's going to stay lifted. Now, the final thing that we did for her is we did lip augmentation, and the reason I do this is because when you lift that smaz layer up, you'll get some bunching of the connective tissue around the ears, and so I always cut a little strip of it out just to prevent fullness in this part of the ear. And so we can take that little strip of connective tissue, muscle, fat, and throw it in the garbage, or you can implant it into different places on the face. And one of the places I like to put it is in the lips. You make a little stab incision here, create a tunnel through the lips, slip that little piece of smaz into the lips, and it does a beautiful job of just giving fullness, plumpness, without looking weird or overdone. They'll look bruised and swollen in the beginning, but once they settle in at 6 weeks, like, it does a really nice job of giving mouth enhancement. And I'm a big fan of making sure that you remember to rejuvenate around the mouth. Don't do all this and forget the mouth, because this is something that certainly can age you. So anyway, we're really happy for Diane and happy for her result at this point. But these were some of the things that we went through in deciding which procedures and techniques and approaches were going to be right for her.